Hello, everybody. I'm going to pull my mask down so you can hear me. We're all wearing masks around here now, and maybe you are too. It's certainly a different world, I think, since maybe the last time I was able to do one of these talks. So it's really good to be with you and talk to you today. I appreciate you taking the time to listen to this. I just wanted to try to say hello and encourage you and let you know sort of what's going on here, but also we certainly want to make sure we take time to take questions. I know a couple of questions have been sent in already, but we would certainly encourage you to take some time and send some others in before we get off the air so that we can answer those also. The first thing I want to do is just say thanks to everyone. Thank you so much for what you're doing. We are really living through an extraordinary time, one of the most extraordinary times in my life, actually. I've never been through anything quite like this, and I think that's probably true for most of you as well. We are sort of figuring this out on the fly as we go, and we have probably gotten some things wrong. Hopefully we're getting some things right, and eventually we know we'll all get through this together. But I've just been so incredibly impressed. I've been so appreciative and so proud to be part of this organization. There are so many people that are doing such amazing work, and I hear about that all the time from people outside the department, but I witness it with my own eyes as well. I know that so many of you are just working so hard, and it seems like every week is 7 Mondays, and we're just sort of working full time right now. But we really do, I really do want you to know how much I appreciate it. We are really making a difference in the lives of people in our state. We are saving lives of people in Alabama, and that's there's really no higher calling than that. And I want to again just say thank you for all you're doing. It's been a little more than a week now since the U.S. passed a pretty grim milestone of having over 100,000 deaths in our country. We've lost over 650 Alabamians to this pandemic as well. We're approaching 20,000 cases in our state, and you know, our first case was actually still less than 3 months ago. We've not even reached the 3-month mark, and yet we're approaching 20,000 cases, and we feel like there are a lot more. The pandemic has really been something that's taught us a lot. You know, this was a disease that no one knew about before. We had no idea really what it was going to look like, and we had a lot of estimates and models and guesses, and some were right and a lot were wrong. I think the thing that was most surprising is that if you remember these models we were talking about back in March and in April, we really thought that our state was going to get overwhelmed all at one time, and all our hospitals were going to fill up at one time, and we were going to have this big surge. And that really never materialized. A lot of the reason it didn't is because our state was able to take some steps. It was able to implement a shelter in place. It kept a lot of people out of public and a lot of people from mixing together, and we're confident that made a difference. But also there were just some things about this disease that we didn't expect really, and what we've seen is that we have these hot spots that pop up among really vulnerable people, like nursing homes, for example, or in jails or in certain kinds of workplaces. And so even though we never have had a statewide surge that sort of overwhelmed the state all at once, it seemed like every week we have 2 or 3 places within our state that are seeing a surge and are completely overwhelmed, at least for a few days. And so at the moment, we have a big hospital surge going on in Tuscaloosa. We've had one here for the past almost 2 weeks here in Montgomery, where ICU beds are maxed out and the hospitals are really full. The Montgomery hospitals have reported more COVID patients this week than they have ever had during this entire time. It was really only a few weeks ago when we were talking about this same problem in places like Mobile, down in Greenville. But, you know, at the very beginning, you may remember this is what we were seeing in Birmingham, particularly at UAB, and also in Opelika in Lee County. And so it seems like as soon as we get one hot spot sort of taken care of, or it sort of runs its course, then we see another one somewhere else. So we continue to recognize that the people really at risk for this disease are those who are especially vulnerable. These are people who are older. These are people that have chronic health problems. And in a state like Alabama's, where a lot of people have chronic health problems, there's still a whole lot of people at risk. So as the state moves to open up its economy, like every other state is doing now, we know we are going to continue to see this disease. We're going to continue to have outbreaks, and we're going to need to continue to respond like public health has been doing. We've got a few more months of this, unfortunately, although hopefully now we have a lot of things in place that will help us be able to respond. I know that many of you are working really long hours. I know many of you have worked holidays. We've had at least 3 state holidays since this started, and I know a lot of you have worked all of those holidays and banked that time, and I do want to let you know that I really appreciate that. The next state holiday we have coming up is July 4th. The 4th falls on a Saturday, but the state holiday will be on Friday, January 3rd. Our plan is to treat that like a state holiday. We want everyone to be off on July 3rd, and I'm going to tell you to please go ahead and make plans to do that. Now that said, that's a month away, and we don't know what's going to happen. And so there could be some disaster or catastrophe that we have to respond to. We understand in public health that that's our role and that's what we do. But I appreciate so much the fact that you've all been willing to work day or night or weekend or holiday so far. And we really, really want our folks to be able to take off the July 4th holiday. If you do that, you got to do it safely. Please don't be in a group of 5,000 people eating barbecue and shooting fireworks. But please be socially distanced in a safe way. Please spend time with your family, but if you spend time with your friends and neighbors, make sure you do it in a safe way. Again, we've still got a month to go to get there, but we plan to whatever extent it is at all possible to make sure that everyone gets that holiday off just like you normally would. We know you've all been working just so hard so far. What's been happening here in the past several days is us working on plans for obtaining money for the department to respond to the COVID-19 effort. You may remember that the U.S. Congress appropriated about $1.8 billion to the state of Alabama. That's not all for public health. In fact, most of it is not for public health. A lot of it will go to things like the Department of Labor for unemployment benefits. It'll go to small businesses. It'll go to the education system. It'll go to many others that are seeing consequences of COVID-19. But we believe a lot of it will come to public health as well, and it's going to be the primary source that we pay our workers for all the extra work that you've been doing. That it'll be the way that we pay overtime for those folks who are eligible for that, who have earned that. It'll be the way that we pay for our testing programs that we will continue to do in our county health departments. It'll be how we do our contact tracing and case investigations for all the cases that we're seeing. We expect that public health will need to be continued in this effort for some time, and the testing clinics that you all have been doing, going from place to place, is something we're going to need to continue for some time. To that end, we have plans now to add staff in each of the districts, to add additional brand new staff who can be strike teams for us to respond to outbreaks in a given district or in a, for example, workplace or in a nursing home or in some other type of facility where we need to get staff in right away and do testing. These staff can also be involved in a lot of educational efforts for us. They can help us with fit testing. They can do CPR training. They can do a number of other things when they're not directly working on outbreaks, but also can be responsible for the testing that we're doing. And so we will continue to do that for as long as we need to do that. It's still not clear how long this is going to go on. We're hopeful that we'll have a vaccine at some point. If we are able to do contact tracing well enough and isolate people well enough, the disease could just sort of fade away on its own. But nobody's really counting on that right now, given the numbers of disease transmission that we're seeing right now. So again, to everyone, let me just say thank you. I want to say we just really appreciate all your efforts. I know there's so much going on. There's a whole lot of questions that you may have. There's a couple that have been sent in. We're going to start with answering here in just a minute, but I hope you'll please send in your additional questions so we can answer those while we're on the air today. So I'll let Brandon ask the first question for us.
This first one, Dr. Harris, is, does the state of Alabama or ADPH have any plans in place to offer emotional support or counseling opportunities for healthcare workers or first responders working daily on the front lines of the pandemic?
Sure, that's a great question. The question has to do with emotional support for people who are working on the front lines. I can only imagine what it's like for you who are literally seeing patients every single day. I'm not doing that, and it's so much more difficult to be at the bedside or to be on the front lines. We have, as you know, the EAP, the Employee Assistance Program, which we strongly encourage you to utilize if you feel like you need additional help or you need support. That's a great first place to start. We are also meeting here in administration to try to develop something that will be longer term. We know that people do need support. Mental health is extremely important in times like this, and so we tend to roll out something more formal, something a little better developed as soon as we can get that fully fleshed out, and we'll get that information to you right away. You know, the things that people can do on their own are actually really helpful. I would encourage you to, if you can, particularly in the evenings or on the weekends, stay away from COVID news. Just turn it off. Don't be on social media. Don't watch the news, because that just tends to create a lot of anxiety. Make a lot of effort to have regular sleeping hours if you can. Be careful about eating healthy foods. Be careful about alcohol intake. And certainly try to get out and do some exercise. Anything you can do to get outdoors in a safe way, to get your heart rate up, to exercise, those things just do a tremendous good in terms of improving your mental health, and I would encourage you to do that. But in the meantime, we are working on a more formal program that we'll let you know about soon.
All right, and this one comes from the county level, and basically asks, what's the protocol for essential workers when it comes to testing positive for COVID-19? What are the quarantine guidelines, returning to work guidelines, deep cleaning, etc.?
Sure. So in terms of when you've been either infected or exposed, there's a little bit of different guidance depending on what kind of job you have. For those folks who work in healthcare facilities, like in hospitals or nursing homes, if we know that they have been exposed to an active case, there are some conditions under which they can continue to work. They're not automatically sent home, and that's simply because those workers can't always be replaced. If you're exposed to an active case, the best response is to go home for 14 days, period. And that's what we would encourage everyone to do if that's an option. But there are certain people, particularly in healthcare, who can't do that because you just don't have a replacement. And so when we have people that have been exposed but aren't sick, they can be allowed to work, but they have to do it in a safe way. We want them to wear face coverings or masks. We want them to wear gloves if that's appropriate. We want to make sure that they're doing temperature checks. We want to try to keep them working in a location where they're not around other people to the extent that's possible. Certainly, we don't want them taking care of really vulnerable people. Again, if that's an option, think, for example, of a nurse in a hospital. We would certainly not want that person working with very old, very sick people in an ICU, for example. But there might be other duties that could be done that wouldn't put that nurse in close contact with people. So if you have an exposure, again, the best answer is to go home for 14 days. But if not, there are some exceptions that we can make. There aren't really sort of standard protocols for cleaning that are different for COVID than for anything else. COVID is pretty easy to kill in the environment with your standard environmental treatments, just like you would clean for anything else. And so we do have the environment cleaned and sanitized quickly and thoroughly, just like we would for anything else. But that typically is enough. For people who are infected and have been sent home because they're sick, we want those people to wait before they can safely return, at least 3 days after their fever's gone away without the use of any fever-reducing medication, and at least 10 days after their symptoms started. We want them to be symptom-free, including fever-free, and wait at least 10 days before returning. In certain cases, like, for example, nursing home patients who are hospitalized but going to go back to the nursing home, we may even ask for repeat testing to make sure they test negative before they go back. But that's not generally necessary for most people in the workforce who aren't going to be in a situation like that. Okay, all right. I don't believe we have any additional questions at this time. So again, just let me wrap up by saying thanks again for all the hard work you're doing. I know everything seems to have been about COVID now for 3 months. We're still continuing to do a lot of other things in public health, and I know that all of you are working hard in your own individual programs, even if you're not directly working on the COVID response. But thanks again for all you do, and I look forward to talking to you again soon.